The fact is that too many people have diabetes. Too many people have asthma. Too many people don't have access to primary care. There's just all these problems. They're not going anywhere. We don't live in a sterile world. The Center for Health Disparity Solutions is a community of faculty, staff, students, and community leaders who are interested in how place influences health and healthcare outcomes.
So we define place-based determinants as any setting where the disparities may occur. So place-based disparities could occur in a health system. Place-based disparities could occur in a neighborhood.
I always say it's easy to tell patients and doctors, you need to do better. You need to take your medicine. It's harder to tell the mayor or the governor or business titans that they need to do better. We don't have broken people. We have broken systems. Every year we send out a call for proposals for people who are interested in doing research in health equity and health disparities.
You know, throughout my doctoral training, I had always known about the Hopkins Center for Health Disparity Solutions, and I was really interested in answering a question about how the opioid overdose crisis in Baltimore City had really differed from community to community.
With the Center for Health Disparities, I could do the work that I was already doing, plus I can do a project that explores something of my interest.
I got the pilot maybe a year after I joined faculty. It would allow me to get my hands in the data and just really get good practice. It turned into this huge project where we, built out this data set. It was a lot of work that I didn't know I was that I was getting into. But I really have enjoyed it. It certainly it didn't stop with the end of the pilot period.
So it's not just one-off research projects, but we're trying to build something that will eventually create an evidence base that policymakers can use for decision making.
One of the things that I really enjoy about the pilot program, we link them up with the community core. Oftentimes, we know how to articulate our science, but we don't know how to really break it down and make it plain for a lay audience.
We talk to people on the ground about what they think the main problems are, and then we try to work with them to think about what the solutions are.
There are so many people who are really invested and really want to be listened to. You need to start with equity and not just the numbers game of, well, who is the largest number dying of.
We try to touch major aspects of disparities that starting at an individual level, going to the community, going to the country, going to the policy.
The center has the resources that someone would need to advance as a professional, ranging anywhere from the funding, but also the mentorship, the infrastructure, the committees, the involvement of the community and funding agencies, things like that. I mean, it's helped me get to where I'm at.
It's really great to come around with like-minded people, so when we have different types of summits, conferences, work groups, or just gatherings, it's just really nice that you could come and just brainstorm people. Oftentimes I've just been sharing my different ideas or just kind of brainstorming things that came off my mind, and it's turned into different publications or just avenues to explore for grant opportunities in itself.
And the peers are very nice. I've been talking with people a lot at the center. Some of them are postdocs like me, others are research scientists or early career faculty, but all of them are very nice and supportive.
It was definitely my tribe of people who care about the same issues, is passionate about health equity, and trying to make the world a better place.
And one of the things in which I'm really very proud about with regard to the center is we create leaders, people who are going to be academic leaders.
I'm extremely hopeful for the next generation of researchers that are coming, and to think about the impact that their work's going to have. It really excites me and it keeps me going every day.
We got a new set of stars, and they're rising, and it's going to be a real pleasure to see who and what they become as their careers mature.